Hey, it's Birdman. I'm hanging out here at Summit Healthcare. So this is, of course, the Summit Healthcare Facebook page. We'll be sharing this out all over everywhere else, but it's live right now here. I'm here with a Dr. Diana Anderson, and she's the infection prevention nurse. Make sure I get that right. So she's a doctorate. So actually, I'm going to flip it over to her. Diana, how are you?
Hi, I'm good, thank you. How are you?
Good. So tell me, first of all, what's your doctorate in?
Health administration.
Okay, health administration, and your position here is once again.
I'm the infection preventionist, or the infection prevention nurse. I'm also board certified in infection control and prevention.
Okay, so there's a lot of anxiety, I would say, around COVID-19, which is part of the coronavirus. Can you first of all explain, coronavirus isn't new, is it?
No, coronavirus has been around a really long time. There are 7 forms of coronavirus that affect humans. You've all heard about SARS, right?
Right, SARS.
Severe acute respiratory syndrome. That's a form of coronavirus.
Oh, okay.
So's MERS, which is Middle Eastern Respiratory Syndrome. And those are the bad ones that you hear about on the news a lot.
Okay.
There's also 4 strains of coronavirus that cause basically the common cold.
Okay.
And so if you're diagnosed with coronavirus, but it's coronavirus HKU1, 229E, NL63, or OC43, those are coronavirus forms that are very, very mild. Generally, people are not hospitalized for those. We find them incidentally when they're hospitalized for something else.
Okay.
Okay. COVID-19 is not the same. It most closely resembles SARS, or severe acute respiratory syndrome.
Okay.
It can be a lot more serious than the other coronaviruses. So if you hear that someone at Summit has coronavirus, we're talking about one of the 4 simple strains.
Okay.
At present, we have no confirmed coronavirus patients, or COVID-19.
COVID-19. So no COVID-19 patients.
No COVID-19 patients.
At all.
I will say we have 2 that meet criteria, and I've sent the test down to Phoenix to be tested, not because I really think they have it, but because I think we owe it to the patient to be sure,
Right.
and to the community as
So
well.
what are those? You said they meet criteria. What is that criteria?
Well, we're looking for people with fever, with trouble breathing. They may have a cough, heavy cough. It's not necessarily the same as the flu. With the flu, it's usually upper respiratory, up in your head, your
Right.
nose, congestion. With this, it's more lower respiratory, more like a pneumonia.
Right.
So we're looking for people, especially people that are hospitalized. You know, just because you cough once does not mean you probably have COVID-19.
Right.
But if you're running a fever greater than 100.4, or if you're a very bad cough, or you're congested, or if you're having trouble breathing,
Right.
by all means, then, look for professional help. And you can do that a couple of ways. You can call your physician's office. Please don't just show up there, because if you do have it, you don't want to contaminate their office and other patients and family.
Okay.
Or you can use our Summit Cares, which is a teledoc service.
Okay.
And they are very, very well prepared to deal with any possible COVIDs. Or if you're really having severe trouble breathing, then by all means come to the emergency room. But again, please call first so that our staff have a chance to protect themselves as well.
So I was watching yesterday, and one of the top people at the CDC was saying that, if you think you have it, the best thing to do is to stay at home and isolate yourself. And can you explain sort of like the difference between isolation and quarantine and stuff like that?
It's such a great question, because I hear that all the time. Quarantine is another name for social distancing. In other words, you stay home, you may or may not have symptoms if your symptoms are mild, etc. But you're either staying home or staying in a designated location, and you're going about your business. You're not receiving health care services particularly, other than somebody maybe coming in to check your temperature, etc. Isolation is a medical procedure. It's something we use in the hospital for anyone who could be remotely contagious. And we have different levels of isolation depending on the disease causing it. So if you come to the hospital with measles or chickenpox or TB or MRSA or the flu or human metapneumovirus or any of those kinds of things, chances are good you'll be placed on isolation. That means the staff wear special gear to come in and out to protect them from carrying that germ to other patients. And it also means that you're in a special room. Your visitors have to garb up and everything before
Okay.
they come in.
So tell me, what's the best thing people can do right now to keep them out of the area, or protect themselves? What's the best protection a
Okay.
person can do?
Number one, stop panicking. Stop getting so worked up over the thought of COVID.
Okay.
Because 80% of the time, COVID is going to be really mild. You may not even know you have it. The reason why we're geared up for it is because the 20% that it could be serious, we need to be ready to provide care for them.
Okay.
So not panicking is number one. Number two, wash your hands.
No. Wash your hands?
Yes, soap and water is great. Alcohol gel works too, but I understand that most places are sold out of alcohol gel.
That and toilet paper, which I don't
Toilet
understand, but
paper,
anyways.
Yeah, well, just remember toilet paper is made in China.
Good one.
Sorry.
Okay, so wash your hands.
Wash your hands. Soap and water. It's a simple and easy thing to do. If you have a cough, don't cough into your hands. Don't cough into other people. Cough into a Kleenex and then throw the Kleenex away, or cough into your sleeve. Okay. Please don't cough into your elbow and then bump elbows with people.
I know, there's
You know,
that. Yeah.
Avoid people that are sick. If you're immunocompromised especially, avoid people that are sick. So it might not be the time to hang out at a very crowded convention or rally or something like that. Wearing a mask does not help you unless you're sick.
Okay.
The surgical mask.
Could you say that again?
Wearing a mask does not help you unless you're sick.
Okay.
All right. And the reason for that is the surgical mask that's worn, the whole reason why the doctor wears it in surgery is to keep him from coughing into an exposed area. So if you're sick, if you think you might have COVID, put a mask on before you're around people. But if you do not have COVID, or you don't think you have COVID, wearing a mask, that surgical mask, is not going to protect you. Okay. Now, healthcare providers will be wearing what they call N95 masks. That is to keep them from breathing it in, getting sick, and then not being available to take
Right.
care of people with broken legs and other things. So,
Awesome. So basically, don't panic. Wash your hands. Stay away from sick people.
correct.
Okay. Anything else?
No, the World Health Organization did declare this a global pandemic
Okay.
just a few minutes ago. I think we need to take it seriously, but we don't need to go overboard. We don't need to panic. You don't need to be scrubbing down your car doorknob every time you get in and out of the car
Yep.
because you're afraid somebody might have bumped into it. There's a lot of rumors out there. There's a lot of gossip out there. Please, if you have questions, ask someone with answers. I'm doing a symposium at 5:30 here at the hospital. Dr. Mansfield, who's one of our physicians here, and I will be presenting, and we'll be talking about both the medical aspects of COVID, as well as how the hospital is gearing up to protect the community in the event that it does show up.
Very good.
So,
Awesome. Okay. So there you have it. Get your information from official sources. That's why this is on the Summit Healthcare page, and we didn't even do it. And I'll share it out on Birdman Media, but that's why it's here. We want you to get it from official sources. So that would be Summit Healthcare in this case. Of course, you get it through your county health departments, things like that. But make sure you're vetting everything. I wouldn't go to pages and the groups on Facebook or Twitter or anything like that. Just get it from official sources. We'll let you know if anything's going on. I'm Birdman, and wash your hands and have fun.